Good morning to all of you, distinguished representatives from all member states, India, Thailand, Japan, and the United Kingdom. Thank you for all of your participation today. I am from India and will be the chairperson for today's meeting negotiation. In this meeting, we will discuss the India and Thailand proposition on the issue of waiving intellectual property of COVID-19 vaccine for the sake of public health. For today's meeting also, I will let all the member states to just proceed with the opinions on the issue to save time. On this issue to save time, I will only intervene and stop the meeting if I find there are unnecessary points raised by the member states or undesirable events happen. Without further ado, I would like to invite the Foreign Minister of India to deliver the opening remarks first.
Good morning, I beg to Mr. Chairperson and all distinguished members of WTO. As the Foreign Affairs Minister of India, I will give an opening statement. Your Excellency, on 11 March 2020, the World Health Organization (WHO) declares COVID-19 as a global pandemic that caused a public health concern among the international community. Subsequently, the World Trade Organization (WTO) has warned that the pandemic will present an unprecedented disruption to the global economy and world trade as production and consumption are scaled back across the globe. Up until this date, we have witnessed a decline in global production chains coupled with growing consumption gaps. Given the current global emergency, it is important for us, the WTO members, to work together and ensure that intellectual property rights are not barrier to the availability of the affordable medical product, including vaccine that is essential to combat COVID-19. The COVID-19 pandemic is now widespread, affecting most WTO members. As of October 2020, there were about 333 million recorded cases globally with over 1 million deaths. Hence, in order to effectively respond to the COVID-19 pandemic, all countries need a rapid access to affordable medical products, which include diagnostic kits, medical masks, and other personal protective equipment, and ventilators, as well as vaccine and medicine for the prevention and treatment of patients in direct need. Consequently, this resulted to a swift increase of supply-demand globally, with many countries facing shortage, restricting our ability to effectively respond to the pandemic. Shortage of this product has not only put the life of health and other essential workers at risk and lead to many avoidable deaths, but also threatening in terms of its extension or prolong. As a new vaccine for COVID-19 are currently developed, there are significant concerns how this will be made available promptly, in sufficient quantities, and at affordable price to meet global demand. Thus, this critical shortage globally have encouraged India to propose a solution to all WTO members, which is to support our proposition on waiving an intellectual property of COVID-19 vaccine on the basis of Article 31 of TRIPS Agreement. With that, thank you.
Thank you, India. As Thailand's Minister of Law, as permitted by our Prime Minister, I would like to articulate our determination for an intellectual property rights waiver for novel coronavirus vaccine as proposed by India. As a member of the World Trade Organization and the World Intellectual Property Organization, Thailand generally complies with international intellectual property standards established by the Agreement on Trade-Related Aspects of Intellectual Property Rights. Copyrights are well protected in Thailand and without any registration requirement, as Thailand protects geographical indication through a sui generis law. However, as the world is facing a global crisis of coronavirus pandemic, all countries are racing to slow the spread of the disease by seeking vaccines from all pharmaceutical giants, but the distribution of the vaccines is dawdling due to the intellectual property claim by the supplier. This claim would leave high fees upon the demanded vaccine, which subsequently will affect mostly the developing countries, including Thailand, as stated by India just now. So Thailand agrees with India's proposition and would also like to raise IP waiver for the vaccine, as the waiver will allow production of vaccine to be ramped up and provide more affordable doses for less wealthy countries. Thank you.
Thank you, Thailand. I represent my country, the United Kingdom, as a Prime Minister here to address the concern raised by the respected representative of India and Thailand. In the current situation, the World Trade Organization still has no definite decision on IP waiver. However, the United Kingdom opposed IP waiver for COVID-19 vaccine. The issue that arises now is the huge supply gap between rich and poor countries, but IP waiver itself is not enough and sufficient to narrow this gap to supply COVID-19 vaccine. This was a statement made by the head of the World Trade Organization. We also need to take further precautions regarding legal and business implication of IP waiver towards the industries such as patent protection and closed trade disclosure, which could affect the industry's future income and lead to unforeseeable crises. IP rights is a serious matter which is regarded as a source of innovation relating to the process of research and development. I open the stage for my fellow minister to continue.
As a Deputy Prime Minister, I reaffirm the stand of my Prime Minister. IP waiver itself is not a priority in this pandemic. The main priority is to save lives globally with the COVID-19 vaccine. Hence, we can put aside the proposal relating to IP waiver. The push and proposal for IP waiver is actually a global political theatre. In other words, this is actually a global political stage drama. IP waiver is actually will not address the problem of insufficient vaccines in the world. In other words, even with IP waiver, the quality, safety and effectiveness of vaccines might not be able to be maintained. This is due to the reason that vaccines must be made in high-tech facilities whereby this technology is not available across the globe. In worst-case scenarios, even if the proposal of IP waiver is approved, there are some countries which may not even know how to produce the vaccines. I would like to pass the floor to other countries to voice their opinion on this matter.
Okay, thank you to the Deputy Prime Minister of UK. Okay, so as the Prime Minister of Japan, I agree with the contentions brought forward by the UK opposing the waiving of intellectual property rights of COVID-19 vaccines. If IP rights are not properly protected, it will reduce investment and essential products may not be developed in future crises. So we are yet to understand the basis for the proposal on waiving the IP rights and why the current IP framework is not working. We are of the view that waiving the IP rights of COVID-19 vaccines could exacerbate global shortages of vital components for vaccines and start anxiety about product quality. IP rights waiver would not necessarily guarantee the production of vaccines with quality equivalent to those currently available. We are deeply concerned that if vaccines are made in an uncontrollable environment, it will intensify scarcity of raw materials as well as further delay in distributions. So according to the Japan Pharmaceutical Manufacturers Associations, the pharmaceutical industry is making every effort to increase the manufacturing scale and supply capacity of vaccines by a number of alliances and technology transfer. So for biopharmaceutical-like vaccines, waiving IP rights cannot assure the production of comparable vaccines, which will eventually lead to concerns about the quality and risk the side effects risk of side effects could increase as well. So with number of alliances among corporations, the pharmaceutical industry has advanced R&D for vaccines and therapies at an unprecedented speed and scale to address COVID-19. So IP rights are the source of innovation to facilitate such R&D alliances. Thus, we do not see the need to waive the intellectual property rights of COVID-19 vaccine. So maybe any of my minister would like to add on.
Okay, to carry on with Japan's contentions, as the law minister, I would also like to point out some legal implications if IP waiver is to be done. Aside from patent protection being excluded, among others is the disclosure of trade secrets. Releasing the trade secret could risk our pharmaceutical industry viability, as we had proceeded with our own investment and could not sustain the impact of such waiver, as the revenue from the IP right is precluded. And it is not sustainable for the future endeavour and innovation of the vaccine. As we know, the reports on new discovered variant of COVID indicate that the vaccine should be improved throughout the time. Thus, IP waiver can affect our industry financial capability to remain innovative as a result of loss of revenue. We believe that there are other ways to balance the interest for the country who seeks the vaccine and the vaccine source countries. Hence, these are the basis for our opposition.
Good thoughts of Japan. I would like to address as a second Deputy Prime Minister of the UK myself. I understand the concern and procurement of Thailand and India for IP waiver. The recorded death of India due to COVID-19 is also worrying. However, with this proposal of IP waiver, you see more cons than pros. But IP waiver is basically will erode revenue and deter innovation. IP waiver could also result in an efficacy, safety, and a bad quality of the vaccine, as only a small number of people are expert with it. Next, I open the stage to my fellow minister to continue.
In addition, there is no need to approve IP waiver as the World Trade Organization, or the WTO, already has plans to boost vaccine output without the need to approve IP waiver. In an event of an IP waiver, it is mainly to increase the vaccine output in order to control the COVID-19 pandemic. With that being said, again, there is no need to accept this proposal because vaccine producers and developers have already made pledges to increase supply to vulnerable developing countries at production cost. Thus, instead of opting for IP waiver, the United Kingdom humbly suggests other better solutions and alternatives with relation to the COVID-19 vaccine. Now, we would like to know why India and Thailand would like to leave the IP waiver for vaccine.
I, representative from India, and I believe that IP waiver is the best alternative to control this global matter. I do understand UK and Japan concerned, but in India, COVID-19 cases are peaking once again. Vaccination centres are announcing shortfalls and state government are raising a red flag on the dwindling stocks. From the available number on vaccine and the rate at which India must vaccinate its most vulnerable in order to meet targets, a shortfall seems imminent. The exclusive deal between IP rights holders and manufacturers have failed to generate the required number of vaccines to inoculate the critical mass of the world population. Along with the scale, the speed of inoculation is equally important as the virus has shown its tendency to mutate rapidly, potentially rendering the existing vaccines useless. The exclusive deals have also led to the lopsided distribution of vaccines in favor of rich nations. Western countries have monopolized by buying existing supplies and pre-purchasing future rounds, as wealthy countries have been making deals directly with manufacturers since the second half of last year and procured large quantities of vaccine. It is no surprise that 40% of all doses have been administered in high-income countries as of late April 2021. Statistically, this represents 60% of the world population. Here's just how unequal the global coronavirus vaccine rollout has been. This call for freeing up IP rights that have conventionally acted as the biggest impediment in generic drug manufacturing. India resort to an emergency waiver mechanism whereby the intellectual property right for making vaccines until widespread vaccination is in place globally. And most of the world has developed immunity to the coronavirus, which in theory will lead to production and distribution ramping up more equitably in factories worldwide. There is no doubt that intellectual property barriers limit equitable access to tools such as vaccines. Giving away patents is the solution to make vaccines available to more people. Waiver is necessary scaling up vaccine production to provide more affordable doses for less wealthy countries and ensuring equitable access, especially during pandemic. It's time for all WTO members to take collective responsibility and put people's life before anything else. History will not judge us kindly if we do not act immediately to save large-scale loss of human life and health and allow global dysfunction to prevail over global cooperation. We hope that members will support our proposal that will ensure that vaccines become truly global public goods.
Thank you, India. As the Minister of Science and Technology in Thailand, based on Thailand's COVID-19 situation right now, I would agree with India's suggestion. No barriers should stand in the way of equitable access to vaccines, including intellectual property, which is why we are supportive of a narrow waiver during the pandemic. Intellectual property protection will definitely slow the access to COVID-19 vaccines, as according to researchers, it could take 2 or more years for people in the lowest income groups to be vaccinated. But people are dying every single day. So if the waiver was granted, it would allow countries who are WTO members to choose to neither grant nor enforce patents and other intellectual property related to all COVID-19 vaccines during this pandemic. And as COVID-19 is a global health crisis, it would definitely contribute to the public's interest worldwide. Thus, until a large proportion of the world's population is vaccinated, we are unlikely to see the end of the pandemic.
Alright, and thank you, Minister of Science from Thailand. Firstly, I am the Foreign Minister of Japan. We truly understand the current situation and willingly to cooperate for a better future. So if I may simplify this proposal, the reason to waive this right is to boost the production of vaccines in our country, as said by representative from India and Thailand. However, this might cause us to lose public confidence. Secondly, we, Japan and the United Kingdom have manufactured and procured the vaccine with a strong focus on signing pre-orders to the point that there is a surplus in our country. So I do not see any reason to enter into this agreement. These doses have already exceeded 4 times in the country's actual population. In fact, in Asia, Japan has the largest number of vials as it gears up for the Olympic in the summer. As for the United Kingdom, in short, they managed to procure 3.6 times the country's actual population. I am sure we all agree that no one is safe until everyone is safe, but a call for waiver is not the answer. The grant of IP does not provide any assurance. Even originator products of multinational pharmaceutical companies have been recalled for failing quality standard. Hence, we humbly ask for another alternative other than IP waiver to cope with the ongoing threat of new variants of COVID-19.
Thank you, Japan. I will then pass the floor to Thailand first, and then secondly India to respond to the argument made by Japan just now.
Alright, as the Minister of Health in Thailand, I would like to propose the other alternative way through compulsory licensing. In between November 2006 and January 2008, the government of Thailand granted a series of compulsory licenses to allow the import of generic equivalents of 7 patent drugs in the country. These licenses were granted in accordance with Section 5.1 of the Thai Patent Act PE 2522. We justified the use of license on the grounds that it is needed to ensure access to essential drugs that had been proven effective and necessary for treating disease with high prevalence that were increasingly becoming major public health concern in the country. The imported generic drugs were to be for use under the National Health Insurance Scheme. Since 2002, Thailand has provided universal health coverage for its population of 64 million, with all Thai people now covered under one of 3 national public health insurance schemes. Coverage under the health insurance scheme entitled patient access to drugs on the national list of essential medicines.
Okay, so as Thailand's Minister of Foreign Affairs, the usage of generic equivalents of patented drugs has been highlighted as a long-term cost-cutting strategy. But however, in order to import these generic equivalents into Thailand, government use licenses were required. Furthermore, COVID-19 patients are likely to face even more challenges assessing and affording medical treatment in developing countries like Thailand, for example, and other low-income countries with under-resourced healthcare system. And several countries have already publicly considered compulsory licensing as part of their COVID-19 response. For example, on March 24, 2020, Israel issued a compulsory license to import generic version of lopinavir or Advis Kaletra. The Israeli Ministry of Health has determined that the antiretroviral drug could be a possible treatment for COVID-19 patients. And they issued the compulsory license and to generic from India because it was unable to provide sufficient supplies of the medicine, and it also announced that it would not enforce its patents in light of the current pandemic. So in conclusion, compulsory is a powerful public health tool, and it can be gentle for sufficient supplies of necessary pharmaceuticals as well as mitigate prohibitively expensive drug prices. The government of Thailand would use the use of compulsory licensing for this matter. So that's all from Thailand.
Okay, I proceed with India. The weakness of India's vaccination program has come to the fore over the last month as the brutal COVID-19 second wave exploded all over the country. Vaccination centers around the nation have faced shortage, and the current pace would not allow India to reach herd immunity by the end of the year. Since UK and India opposed the suggestion of IP waiver, we would like to consider the proposition of compulsory licensing. When a government invokes a compulsory licensing, It's grant permission to a person to make or sell an invention or product without seeking permission from the patent holder. The question of compulsory licensing in India involves two important provisions under the Patent Act 1970. Plus, Indian industry has a well-respected expertise and capability to rapidly manufacture raw material, consumables, and equipment necessary to produce vaccine. If intellectual property barriers are removed. With this, it approved that India is truly ready in applying compulsory licensing. Again, I hope that members will support our proposal that will ensure that vaccines will become truly global public good and not cause of deterrence to others.
Thank you, representatives both from Thailand and India. I will then welcome the UK first and then Japan to give a response on the alternative provided that is on compulsory licensing.
Thank you, Chairperson. As stated by Health Minister of Thailand, supported by India, with regards to the suggestion of compulsory licensing to be used for COVID-19 vaccine, allow me to clearly elaborate more on this matter. Compulsory licensing sounds better and is indeed an alternative from IP waiver, as compulsory licensing is a situation when a government allows someone else to produce a patent product or process without consent of or patent owner, or plans to use the patent protected invention itself. This suggestion is accordance with a provision as stated in TRIPS agreement based on Article 31, which is other use without authorization of right holder. But we need to understand the usage of this method may harm patent owner badly in terms of viability and sustainability of the business. Next, my deputy will continue.
Thank you, Prime Minister. I would like to further continue with regards to compulsory license. It cannot be denied that compulsory license indeed sounds better and is indeed an alternative from IP waiver. It has come to the United Kingdom's attention that the suggestion made by India and Thailand in considering compulsory license is mainly to cater the COVID-19 cases in their respective countries, especially in India. However, the United Kingdom itself is not aware of any such use under the UK Patent Act 1977. Hence, we are most likely to not consider using compulsory licensing with regards to this issue in the context of COVID-19 pandemic. With that being said, again, emphasize compulsory licensing is a wise suggestion, better than IP waiver. However, UK does not agree to compulsory licensing. We opt for better alternative in relation to COVID-19 vaccine to be globally available. So how about Japan regarding compulsory license?
We agree to the contentions expressed by the Excellency Prime Minister of UK. Compulsory licensing, although can benefit the country who is in need of the vaccine, it can affect the pharmaceutical industry as it is an anti-innovative in nature and in turn counterproductive to our own industry. Besides, there are some legal restrictions in part of our country regarding application of compulsory license. It can only be applied after 4 years have lapsed from the filing date of the patent application in which the patented invention was filed. Taking into account the existence of the vaccine, which is only last year, the earliest that we can apply is in 2024. Aside from that, there must also be an operation of such patent for at least 3 years, which is not the case. We have also noticed that most of the laws in your respected countries have the similar restriction in essence. If we insist on applying compulsory license, there is a need to amend our respective domestic law to clear the restriction, which in our opinion is cumbersome as we need to conclude this in a hurry. We believe there is a win-win solution in which Thailand and India can procure enough vaccine for its needs affordably and at the same time protect the industry and to remain sustainable. Hence, we suggest that the country with surplus vaccines to resell their surplus vaccine that they have managed to procure to the needed countries, which in our case, Japan and UK, to India and Thailand. Of course, India and Thailand will be given ample time to consider the possible terms and conditions for this matter. Thank you.
Thank you, Japan, for the alternative suggestion just now. I will then ask India and Thailand on how they receive that suggestion. So, India first. What is your opinion on the suggestion? So, as suggestion just now.
Thank you, Mr. Chairperson. Thank you to the distinguished member for that suggestion. We would like to ask WTO members to still consider our proposition on waiving IP all alternatives stated by Thailand, which is compulsory licensing. However, we will take into consideration with regards to Japan's suggestion on reselling. Hence, we will give our decision on the next meeting. With that, thank you.
Okay, thank you, India. And what about Thailand? What is your opinion on it?
Okay, so thank you, Mr. Chairperson. So for Thailand, we will ask first, and we will also give our decision during the next meeting. Yeah, that's all from us.
Thank you, Thailand. Okay. Therefore, both India and Thailand want to discuss further on the reselling with their respective countries first. Then I will then adjourn our meeting to 1st June 2021. Thank you.
Good morning to all of you, distinguished representatives from all member states, Thailand, India, Japan, and United Kingdom. Thank you for all of your participation today. I am Liyana Shafiqah, the Minister of Science and Technology from Thailand, and I will be the chairperson for today's session. In the previous meeting, UK and Japan agreed to sell only AstraZeneca vaccine, and the quantity depends on the statistic of India and Thailand's cases. In this session, we will discuss the terms for reselling the said vaccines. So for today's session, I will let all the member states just proceed with their opinions on the issue to save time. I will only intervene and stop the meeting if I find there are unnecessary points raised by the member states or undesirable events happen. Without further ado, I will start the negotiation session. Your Excellencies, the first provision to be discussed is the prices. I would like to pass the floor to any countries to voice their opinion on this matter.
Thank you, Mrs. Chairperson. Japan is very delighted to meet delegates from UK, Thailand and India again to discuss the terms of this COVID-19 reselling agreement. As we all know, vaccines are sold at different prices to different countries. And since the vaccines that we are selling are the surplus in our own country that we also procure from the manufacturer, we would be happy to offer the vaccines at the market price sold in Japan. The proposed price for the vaccines is $7 per dose. We understand the dire situation in India and Thailand. Hence, we have no intention of selling it above market price sold in Japan. At the same time, it is important for us to not go below the market price, as revenue from reselling of the vaccine will be utilized by Japan to buy more vaccines, specifically Pfizer, to meet the needs of our own citizens. As Olympic Tokyo 2020 is approaching, I hope all of us can understand that it is important for Japan to have our citizens fully vaccinated by then. We are very well aware that the vaccine's price might be slightly higher than the price directly offered by the manufacturer to Thailand and India, but we promise India and Thailand a good bargain, as we will deliver the vaccines promptly to you in hope of saving more lives.
Thank you, Japan, for your suggestion. However, as the Minister of Health of United Kingdom, I think $7 per dose is a little too high. Therefore, I would like to propose to the delegation for the vaccine to be sold at the price of $6 per dose instead of $7. Given the far distance between our country and the countries which will be receiving the vaccine, it will increase the cost for our country. The costs include fuel surcharges, security surcharges, terminal handling charges, airport transfer, air cargo insurance, accessorial charges. However, we believe our main contention in this negotiation is to help India and Thailand to obtain the vaccine at the shortest amount of time with the reasonable price to control the COVID-19 pandemic. Hence, we humbly propose $6 per dose and encourage Japan to sell the vaccine at the same price as us. This is in accordance with our contention to tackle this concerning issue in this COVID-19 pandemic.
Thank you, UK and Japan, for the suggestions. In representing my country as India's Minister of Finance, we are in the opinion to oppose the suggestions of reselling the vaccine at the price of $6 per dose as proposed by United Kingdom. The reason why is because the original market price of AstraZeneca sells at the price of $4 per dose, which is the cheapest vaccine available. Initially, the global initiative of AstraZeneca is to distribute 2 billion vaccine doses to low and middle income countries in the developing world at no more than $3 per dose. Although India is known as the largest vaccine manufacturer, there seems to be not enough vaccines available as the manufacturers have not been able to keep up with the demand. Thus, there is the need for AstraZeneca. Therefore, in terms of reselling, India is suggesting differential pricing, which also known as tiered pricing for vaccine price, which means that different classes of buyers are charged different prices for the same product. In the context of vaccines, low-income countries are charged with a reduced price compared to the open market rate through bulk procurement system established by UNICEF and PAHO. The idea behind differential pricing is to reduce financial barriers to vaccine access for low-income countries while providing manufacturers with a profitable market in richer markets so that they will have an incentive to invest in sufficient production capacity and new product research and development. If the reselling price of AstraZeneca vaccine for the developing country is over 10%, it will defeat the main purpose of AstraZeneca, which is to provide for low-income countries like India. Therefore, India seeks for a lower price for reselling vaccine at either $4, which is the original market for AstraZeneca, or $5 per dose in order to curb the scarcity of vaccine in India, which is a low-income country.
Sorry to interrupt, India, but as the Minister of Finance, of Thailand, I can say that we Thailand are in the same opinion with India in this matter. During this pandemic, we are also, as a low-income country, are struggling to sustain our country economy. Just like other states, we are facing lockdown to cope with this pandemic. So most of our economy generating activities and business owners have struggled to remain viable. Besides, the rate of poverty in Thailand also have increased up to 8.8% during this pandemic. Thus, to sustain the economy, most of our revenue has been used up for our own nation. So it will be better if the price remain between $4 to $5 USD.
Thank you, fellow delegates. As the financial diplomat of India, I think we can hold on to the decision on the price and decide it together with the shipment method for the vaccine to be in the finest state upon arrival. Thus, I wish to ask our fellow countries here, what type of shipping is preferable and the shipping arrangements, which is who will handle the shipping arrangements. Now, I would like to invite any country for their opinion.
Japan would like to suggest using FCA to govern our shipping terms. From our past experiences in handling previous batches of vaccines, I'm sure that each of us here understand that transporting vaccines is one of the most complex logistical exercises. Vaccines are shipped using specialized equipment that does not compromise the integrity of the product to maintain its cold temperature. We believe it is our responsibility to ensure the integrity of the vaccine were well maintained, but Japan would prefer that responsibility to be held against us only when the vaccines are with us in our warehouse. Once the vaccines have been transported, it's hard for us to supervise the vaccines because it's already under full control of the courier. Hence, we believe India and Thailand should bear the risk and choose any courier that they were confident with to bring the vaccines from our warehouse to their respective countries.
Thank you, Japan, for the suggestion. However, there is no guarantee for the buyer if FCA is chosen as the method of delivery. This is because the responsibility of the risk and cost are more on the buyer rather than the seller.
We from the UK understand the concern raised by India. However, I, as a Minister of Science and Technology of UK, concur with the suggestion made by Japan to apply the free carrier for delivering the vaccine. This is due to the fact that UK is intending to lower the risk borne by our state. On the other hand, by using FCA, India and Thailand will have the ultimate control over the transportation of the vaccine after the cargo has been formally exported. This means that India and Thailand can rely on their shipping service provider to find the best price and solution for the cargo from our part to the final destination.
I represent my country, Thailand, as the Prime Minister, here to address the concern raised by fellow respected representatives. I disagree with the suggestion brought forward by Japan and would like to propose another alternative way, which is delivered at place DAP. So DAP is a deal in which a seller agrees to pay all costs and suffer any potential losses of moving goods sold to any specific location, and under this agreement, the buyer will be responsible for paying import duties and any applicable taxes, including the clearance and local taxes, once the shipment has arrived at a specific destination. Next, I'll open the stage for my fellow minister to continue.
Fellow delegates, to simply explain it, under DPA, UK and Japan will take on all the risks and costs of delivery goods to the agreed upon location. Thus, UK and Japan are responsible for everything including packaging, documentation, export approval, loading charges, and ultimate delivery. However, the importers, India and Thailand, in turn take over the risk and responsibility of the unloading of goods and clearing them for import.
Thank you, Thailand, for the suggestion. I would like to address the United Kingdom's main concern regarding DAP. For all the past dealings that the UK has done in relation to the transportation of vaccines, and for most international trade dealings, we, the UK, have always used FCA. Hence, we are very familiar with the rule of FCA, and if we were to accept your suggestion, we would most likely have to reconsider the pros and cons of the suggested commercial rule. This commercial rule known as DAP, but we are unfamiliar with it. With that being said, we are not fully rejecting the proposal of this idea. We hope to be given some time to reconsider this matter. In addition, we are re-evaluating all the responsibilities that will be put on UK as what has been mentioned by Thailand.
We do understand that the main contention of our agreement here is to help Thailand and India to tackle COVID-19 effectively through a procurement of vaccines in a much shorter period. However, I think it is important that our dealings do not lead to any unnecessary burden to any parties. Thus, if Japan and UK need to accept the price at 5 USD and DAP terms, it will make us bear most of the cost and ultimately give us a huge loss. With that being said, Japan will agree with DAP, in which as a seller, we will be responsible for all risks involved up to unloading, only if fellow delegates agree for the vaccines to be priced at 6 USD per dose. Hence, Japan can minimize their loss and still did not generate any unnecessary profit from the deal.
Fellow delegates UK, the aim of this AstraZeneca is a vaccine that is made available for low-income countries. This will defeat its purpose if we use FCA, where most of the costs will be borne by India and Thailand. This reselling is the best option that India and Thailand can use now to cope with the situation in both countries while we are struggling in with our own revenue. Furthermore, DAP will be able to help Thailand by reducing the cost of shipment that needed to be borne by Thailand. With the current situation of COVID cases in Thailand, we are aiming to achieve herd immunity as quickly as possible. Thus, when we need a bigger capital to buy vaccine, the slower we can achieve it. Besides, if the United Kingdom and Japan both agreed to use DAP, we will agree to set the price of a dose of vaccine at $6 USD.
I would like to add that the DAP can be a win-win situation between the sellers, UK and Japan, and us as buyers if we understand each other's responsibilities. In addition, DAP offers a way to lower risk to both parties in securing the goods and the shipment of the cost. The International Commerce Center, ICC, indicates that we as a buyer are responsible for all risks and losses associated with the cargo once the goods have been made available to us. In most instances, the load would be made available to the buyer's warehouse. In the event of any additional cost during the shipping process, the seller bears the responsibility. Due to this decreased buyer's risk, DAP offers a minimal liability option and a widespread agreement for buyers wishing to place all shipping risks on the seller. Consequently, India prefers DAP as it gives minimal liability for the buyer and the seller. Plus, it is fair for the state parties if we buy the vaccine at $6.
I appreciate the contention of Thailand and India's minister. As the Foreign Minister of the United Kingdom, I would like to deliver our decision for this situation. Considering the offer made by Thailand just now, we have agreed to be on the same mind as Thailand states. We believe that the DAP will benefit all the states as a whole. We will acknowledge any possible responsibilities to ensure that the vaccine can be quotas accordingly. Hence, we are proceed with the selling price of $6 as proposed.
Okay, so as the Prime Minister of Japan, our decision would be that we also agree to proceed with DAP to govern our shipping terms, as the fellow delegates have agreed for the vaccines to be priced at $6 per dose.
Thank you, Foreign Minister of United Kingdom. To sum up, for both terms, price and shipment, all respected representatives from all member states agreed to proceed with the selling price of $6. And for the shipment, all respected representatives from all member states agreed with the AP.
Thank you, Your Excellency. Now, please let me proceed with our negotiations specifically. In terms of liability, we would like to not be held accountable for any kind of negative implications that might be suffered by the vaccine recipients, since we were not involved in the production of the vaccine, and we believe that any arising dispute shall be brought further against the manufacturer of AstraZeneca instead.
Japan also in the same position as the United Kingdom. It's in our opinion that we do not have any responsibility to ensure the vaccine is compatible or safe to be used by your citizens, and that responsibility lies in your hands. Hence, we don't want to be responsible for any side effects, cases which might happen in the future.
We are grateful for Japan's affirmation on this matter. Now, I wish to continue further in terms of inspect goods. In ensuring the quality of the experience of inspection, we have experts, whether governmental and non-governmental, to handle this matter, but we welcome the importers to send their representatives to guarantee the transparency of the inspection and quality control. Therefore, we would like to hear the opinion from India and Thailand.
In the context of inspection of goods, I, as India's Minister of Finance, firmly agree and with Japan and United Kingdom's councils and decided to also send our representative to inspect the vaccines before shipment.
Yes, as the Prime Minister of Thailand, I agree that Japan and the United Kingdom shall not be liable for the side effect of beyond the control for both states. In the matter of representative, we are on the opinion to have our own representative to inspect the goods before shipment. So all the costs for representative will be borne by our own government, or we can just send the people from our embassy to inspect the goods.
Japan also does not have any problems letting any representative from India or Thailand to be involved during the inspection of goods, and we highly appreciate your willingness to do so. However, we also want to give an assurance that we will ensure the quality of vaccines are good, and if there is any defect, we will take reasonable actions to replace the vaccines before the shipments been done.
Dear representative, in the event of dispute between the parties in connection with this reselling treaty, India and Thailand would like to disclose that the parties shall refer to the formal dispute resolution, which is in arbitration. We believe that in resolving any trade dispute, the International Commercial Court should have the jurisdiction. ICC, such as in Singapore and China, are competent courts to overcome the transaction costs that undermine commercial cooperation between corporations across borders. Hence, in our perspective, arbitration is the most suitable to take over the settlement, and we hope the delegation will consider our proposal.
Thank you, Minister, for your proposal. In contrast with India, the United Kingdom option for mediation in resolving any trade dispute. The informal way of mediation process is designed to give parties a better understanding of each other's business needs at a much smaller scale. As such, it can look for a win-win situation, win-win solution that upholds their respective interests. Hence, we ask for consideration of the delegates on this matter.
I understand that mediation is also a good option in resolving trade disputes. However, we believe that the presence of expert arbitrators can facilitate us better in reaching the same ground when faced with a dispute later on.
Yes, I agree with the reasoning by my minister. Thus, Japan agrees with the suggestion given by India and Thailand to use arbitration in resolving any trade dispute.
Thank you, India and Thailand, for your alternative suggestion on the issue just now. Does the Minister of United Kingdom agree with the suggestion? What is your opinion on it?
We agree with India, Thailand and Japan's suggestion to do arbitration as a method of dispute settlement. So we would like to say that we agree with it.
Thus, to conclude, arbitration will be the agreed method. Therefore, thank you to all the distinguished representatives from all member states, Thailand, India, Japan and United Kingdom for participating in today's session. In today's meeting, we agreed on the price, shipping and shipping arrangement, liability and the method of dispute resolution. Dear fellow delegates, we will end our third meeting for this negotiation and it shall resume in the next session next week. Thank you.